worked at the Texas Department of State Health Services and ended up as a WIC and MCH director in the state of Georgia. And I had often commented to folks that, luck is not a professional development strategy, but that's often the way that we do it. It's like, well, if you get this opportunity and you're lucky, that's great. And also in governmental public health, I also felt at times it was like, hey, thanks for coming to work here. And if you survive the, 7 trials of Hercules, we'll have some great stuff for you to do later. So it's like, the shows get something when they become shows, and, injury prevention directors get something, and Title V directors got professional development once they became Title V directors. But before that, you were on your own. And that's not how you grow a field. It's not how you develop a pipeline. And so 40 under 40, I think for me, is important because it's beginning to lift up people early in their careers, give them opportunities to make impact earlier than maybe the field would have allowed otherwise. And what I've learned over time, the first book that we wrote at De Beaumont, I thought you had to be a world-renowned scholar, and you had to be a genius to write a book. You really just gotta know an editor, and they gotta like your idea. And you write book chapters because you know someone who knows an editor who liked the idea. And so what we're always trying to do with our 40 under 40 is lift. It's not an award. It's not a recognition, right? I mean, it is, but that's not what it's about. It's about then lifting people up and saying, like, here's a conference. You need a speaker on this topic. This is the person to go to. It's a way that we start to, get newer voices, different voices. That, yes, of course you can have Kamara Jones talk about equity. She was, decades ahead of her time when she started talking about it. But then there's also Lauren Powell, right? And she has something important to say. So think about these other folks. And so if there are conferences, chapters, papers, blogs, that's what we want folks really working with us on. And I think, where it's interesting, and the 6 folks who you get to talk to later might have different, or you may agree, but I think the hard part in the first cohort is, in a non-Zoom world, the idea of kind of virtual professional development was not necessarily something people thought of. Oh yeah, of course we could do that. So I think now that we're in a more of a Zoom world, that I am hopeful. This is the one thing I wish we had done better in the first cohort, that I hope to do better in the second cohort, is introduce more mentoring, introduce more kind of professional development, because the 40s under 40s who I know well, I have benefited greatly from that relationship, and every so often they get some benefit out of it too. And I want to figure out how we replicate that on a more program-wide scale. So if I can, if Brittany allows me, I'm happy to take any quick questions that people have. Otherwise, I'll stop. But it's your call, boss, not mine.
Thanks, Brian. So we actually have a whole bunch of questions that we've gotten. I think we might get to them, but if you're willing to stay on the call, we can get to them after the panel.
Cool.
All right. Well, thanks so much, Brian. And yes, echoing everything you said, that this is not just a recognition program, but I think really an opportunity to, lift up young, diverse voices that are changing the field of public health. And so just want to thank you all again for your interest in being part of the program. So before we jump into the panel, which is how we'll spend the majority of the time, I do want to just go over a couple of housekeeping items. So one, when you registered for the call, we received a bunch of questions from you that we've tried to incorporate into the conversation. So we've done some work in kind of summarizing some of the themes that we heard, and hopefully you'll hear them elevated. But if you have additional questions that aren't getting answered, please feel free to use the chat feature in Zoom to submit your question, and we'll try our best to integrate them during the call. And just to say too, if you have questions specifically for the panelists, that's great. But if you also have questions that are more about like the logistics of applying for the program, we're happy to take those too, and we'll hope to get to those after the panel. Secondly, just want to say that to allow for the flow of the conversation, all of you will be placed on mute. Please feel free to keep your camera on. We love to still see your face. But please know that you won't be able to just pipe in, but we'll hopefully be able to get to you after the panel. And finally, this conversation is being recorded. So if you missed something or just want to have this for your reference, we'll be sent out after the call. And we also encourage you to share it with your colleagues as well. So without further ado, I will transition over to my amazing colleague, Dr. Jamila Porter, who will be moderating the panel today. And she's also a current 40 under 40 honoree. So happy to have Jamila moderate the session today. So Jamila, I'll pass it to you.
Great, thank you so much, Brittany. I really appreciate that really warm and kind introduction. Hello and welcome everyone. I'm Dr. Jamila Porter. I'm Director of Resilient Communities at the Big Cities Health Coalition, which is housed within the de Beaumont Foundation. And it's my great pleasure to moderate today's session, which is Coffee and Conversation, Connecting with 40 under 40 in Public Health Honorees. And as a note, I do have my coffee, so all of you are welcome to also literally join us in having some coffee and conversation. As a 40 under 40 in public health honoree, I'm just delighted that all of you could join us today for a lively conversation that will convey what this program is all about. And if you haven't already done so, encourage you to apply. As public health professionals and as a nation at large, we've found ourselves at a critical inflection point. We are simultaneously living through several historic events with the potential to dramatically shift our future. These include an ongoing pandemic, a recent presidential election and insurrection, and a wide-ranging movement for social and racial justice. Public health professionals have the vision necessary to see the many interconnections that exist between these events, between the social determinants of health and the social determinants of equity. And when I say the social determinants of equity, I'm referring to systems of power like structural racism, sexism, nativism, ableism, and poverty that all inform our policies and practices, norms, and values in the nation. And so it's why now, more than ever before, we must uplift and recognize those of us in public health who are working to solve the many complex problems that have preceded us in hopes of building a more just and equitable future for ourselves and for those who come after us. So with this as our framework and backdrop, I am elated to be joined in this conversation by several of my fellow 40 under 40 in public health honorees and superstars. They are Devin Hersey, who is currently a graduate student pursuing a dual master's degree in public health and journalism at the University of Missouri, Columbia. Aisha Pamuku, Policy Fund Initiative Officer at the San Francisco Foundation and founder of Movement Praxis, an equity-centered policy and philanthropic consulting firm. Sarita Sheely, Initiatives Design and Engagement Program Manager for Chicago Public Schools. William Moore, a health educator and certified perinatal educator at the St. Paul Ramsey County Department of Public Health. And she's with us, Dr. Lauren Powell, Vice President of U.S. Equity and Community Wellness at Takeda Pharmaceuticals, and President and CEO of The Equitist, a consulting firm dedicated to disrupting the status quo in public health and healthcare by infusing the tenets of public health equity in healthcare, leaders, institutions, and systems. So thank you all for joining me and for being here. And again, for those of you in the audience, we invite you to continually share your thoughts, comments, and reactions in the chat. And because we've received questions that you shared in advance, we will work to infuse these as much as possible into the ongoing conversation. So first, I'll start with you, Aisha, and then we'll go around to everyone. Tell us a little about who you are, what you were doing when you originally applied to the 40 under 40 program, and the work that you do now.
Thanks so much, Jamila. It is so good to see you and all these familiar faces on this call. I'm really honored to be in your company as always. So hi, everybody. My name is Aisha Pamaku. I'm an attorney who uses policy to make it so that everybody has a chance to thrive and live healthy, prosperous lives. And the way I always frame that is I think it's really important that policy be part of the solution towards health equity, because for so long, racism and prejudice have been baked into policy over decades, over generations. So it's really important that policy and attorneys and lawyers are part of the solution. So when I applied to 40 under 40, which now seems like a lifetime ago, I was the health equity lead for Change Lab Solutions. So I was designing innovative policy solutions to health inequities And I was working directly with folks in government, so a lot of folks in public health departments, especially, to use those policy solutions that we were developing. And in that work, I was very interested in, what is at the intersection of policy and capacity building. And I also came to really wonder, what would it look like if a third ingredient was introduced? So policy, capacity building, and significant resourcing through the philanthropic sector. So that's what brought me to my current role, leading the policy fund at the San Francisco Foundation, which really sits at the intersection of deep investment in those folks in government and outside of government who are doing policy and systems change.
Wonderful. Thank you for sharing that. Okay, I'm gonna take it to Devin. Would you like to go next?
Hey, I just took myself off of mute. You can still hear me, correct? Awesome. Yes. Hey, everybody. My name is Devin Hersey. Thank you for that introduction, and thank you for turning it over to me. So at the time that I applied to the 40 under 40, I have a bachelor's degree, and I had HIV. So really I feel like those are the things that really qualified me for the work that I was doing. I was working as a peer educator at a local hospital. In that role, I'm a person living with HIV, and I really share from my experiences some of the best ways to manage living with the virus. But I was also doing quite a bit of community organizing work, including legislative advocacy, trying to push an HIV modernization bill. For example, I was serving on the steering committee of the U.S. People Living with HIV Caucus, and I was also appointed to the local Ryan White board for a while, as well as this federal advisory board called the CHAP, the CDC and HRSA Advisory Committee on HIV. So I was doing a lot of consensus building and advisory work around the national HIV strategy at the time. And I'll say now I'm doing a lot of the same work. So I've applied to grad school. As we've mentioned, I'm pursuing both public health. I feel like public health will help me become a stronger subject matter expert. And I would like to pair that with my journalism degree that I'm seeking as well, because I feel like there's a lot of stories that need to be told from people who are living with the virus, especially Black people, Black and brown people doing this work. But yeah, it's a little bit about what I do.
Wonderful, thank you. William, would you like to introduce yourself?
Yeah, good morning, everybody. So William Moore, health educator, certified perinatal educator. So as I was applying for the 40 under 40, I was actually just finishing up a career in semi-pro football, and I was working in public health in chronic disease prevention and essentially birth work. The chronic disease prevention work that I was doing was focused on policy, systems, and environment change. So the idea is we spend billions of dollars addressing high blood pressure, diabetes, stuff like that, to treat people later on down the road. But if we invest millions of dollars up front and start with the youth and families in the community, that if we invest those millions of dollars up front, that essentially we could help mold and change lifestyles so that we weren't having to spend billions of dollars later on down the line addressing chronic diseases and stuff like that, and we're preventing them. And then I'd also was working with the Family Health Division of Public Health and became a certified doula and lactation educator to help mitigate the disparities in the infant mortality rate here where I currently live at, which sees Black babies die twice as likely than white babies before the age of 1, and help mitigate the maternal death rate, the disparities in the maternal death rate, to see Black and brown women die at a rate of 243% more likely than white women from childbirth-related causes. So all that work has been, was really important to me. It was always thing for me, that as I was growing up, like seeing how my community, playing sports, being a good athlete, I would always travel across the country and competing. And I'd always see how all these other communities look so much different from mine. And I would always think, why is that community so much different from mine? And it's because of lack of resources and stuff like that. At such a young age, you don't know those things. But I always knew that nobody that I grew up with, none of us decided when we were young that we wanted to grow up, be broke, be sick, die early, any of those type of things. So what, as I got older and I started understanding these things and got involved in public health, I learned that, there are factors that go into these things, like social determinants of health, that help, and institutional structural racism to help really promote these disparities within my community. And that's why I wanted to jump in and fix those things. Right now, I'm still doing that work, but I have added responsibilities as well. I've been redeployed into the incident command system in our county public health department, working on COVID-19 for the past year. I am in charge of not only making sure that tests, but also vaccinations are being done for public, private, charter schools, colleges, and universities where I currently live. And I'm also COO of Black Prana Magazine. It is the first and only Black-owned publication in the health and wellness field that's based out of Tampa, Florida.
Thank you. Thank you so much for sharing all of that. Amazing. And I'll now throw it to Sarita to introduce yourself.
Thank you for that. Good morning, everyone. It's a pleasure to be here in community with you all this morning. I'm Sarita Sheely. I am currently program manager in the Office of Student Health and Wellness at Chicago Public Schools. Prior to joining 40 Under 40, I was a specialist in the office. So meaning I was a content person, a generalist, overseeing technical assistance strategies and working with schools to adhere to our communications initiative that oversees all of our policies that staff have to adhere to, administrators have to adhere to on behalf of students. And all those policies are federal, state, and local mandated. And if anyone knows, Chicago Public Schools is the third largest school district in the district. So trying to get all 638 schools to adhere to over 50 policies is a large feat in itself. So my job is making sure that schools adhere to those policies, but I'm also driving our communication strategy, our technical assistance strategies, and as well as our implementation strategies, and building out frameworks that are actually viable for our schools to actually adhere to in an equitable manner. A lot of our stuff was not. Unfortunately, it actually, made it harder for a lot of our schools who have inequitable resources to actually achieve the goal of being quote unquote healthy CPS certified. So I am behind that driving force, and also currently helping the district develop a mental health framework as well. So because we know returning back to school is going to be very different for all of our students. So that is the work that I do here in CPS.
Great, thank you. Also great to hear from someone working in the education sector and how that connects very directly to public health. And then finally, I'll turn it over to you, Lauren, to introduce yourself.
Well, good morning, everyone. I apologize for my slight tardiness. We have these back-to-back meetings, it's a lot, but I'm so glad to be here this morning. Let's see, where I was when I was nominated or joined 40 Under 40, what was I doing? When I applied, I was the Director of Health Equity for the Commonwealth of Virginia, was working for the Virginia Department of Health. There were a lot of things actually going on around the time that I applied in state government. Virginia had just gone through a rather tumultuous time with our governor. If you think back to 2018-ish, what was happening then, we had a blackface scandal, and racism was put on Front Street and on blast for maybe those who wanted to ignore perhaps its continued impacts, but that certainly impacted my thoughts, and I think the thoughts of lots of people across the community on health equity, especially given the situation involved medical school and a physician, and thinking about how prevalent racism still is throughout our healthcare systems. And as I was the Director of Health Equity, I was working on policy initiatives, programs, and really trying to make an impact on the ground on on health equity. And I really was operationalizing my role on health equity is really being in the community. And so I was never at my desk, but I was always doing my job, and really trying to almost spread the gospel of health equity, if you will, in helping leaders in our communities, leaders in private sector, leaders in government really understand what health equity is and what it isn't. Oh, and what I'm doing now, sorry, I saw the rest of the prompt. What I'm doing now is I am the first ever vice president of health equity and community wellness for Takeda Pharmaceuticals. So this is a role that's new to the pharmaceutical industry and also new to Takeda. Pharma is a very well-resourced industry, but has kind of largely stood on the outskirts of discussions around public health and health equity. It really hasn't been until this emergency that we're in that these entities across the healthcare ecosystem have actually worked together. And so this is a new role, really excited about it. Really excited about the potential for tremendous impact, and most excited to really bring my knowledge and my network of public health. The people who you will meet today are a part of my network, and I bring them where I go. So I'm excited to bring kind of some of the frameworks that we really believe in public health to pharma and to other corners of the healthcare system that, believe it or not, have not necessarily heard of the things that we know so well.
Absolutely. And as I mentioned earlier in our program, over the past year, we've witnessed, right, the social movements and events that have been central to public health, like the pandemic, like the national reckoning on racism. And so back to you, Lauren, just to start, you kick us off in this direction as you were going. In what ways have these events influenced your thinking and work related to public health and equity?
Yeah, I think, and you're referring to like the recent events of this past year in particular.
I mean, absolutely starting there, but go as far back as you need to.
Well, you know, Jamila, I can go real far, but I won't do that to the audience here today. You know, I think that COVID has just made COVID, as well as the unnecessary and untimely murder and modern day lynching, if you will, of George Floyd, have made it clearer to people what we have been saying, what I say is my community, have been saying all along, which is that racism never went away. It just took a different form, and that it continues to be a pervasive force throughout so many parts of our society, and especially in healthcare. I think, you know, COVID-19 has prompted me to think about what my responsibility is as a leader who has been bestowed with this really exceptional honor from the DeBeaumont Foundation. Like, what is my responsibility in really helping to push us further towards health equity? A lot of my frustration in my career has been that we are around so many people that are so comfortable using these buzzwords: anti-racism, anti-racist, health equity, committed to health equity. People, you know, suddenly comfortable using words like structural racism and white fragility, but have no idea what that really means. Especially when it comes to health equity, we have so many frameworks to talk about health equity, the social determinants of health, but we see in this moment that people are so paralyzed and really not knowing how to put that into operation, and specifically in an emergency. So I think all of those things have just lit a larger fire. I didn't really need any more gasoline, but I have more. And it's just made me even more focused and more unapologetic about what I'm really here to do.
Absolutely. Any other thoughts? Remember, we're informal, so don't even trip over each other. It's okay. The audio will be fine.
I have a lot of thoughts. I'm gonna just jump in. So I just want to start with, we've really witnessed an assault on both the public health and the news media. I would refer to it as the politicization of these two systems, but I feel like they've always been political, especially when it comes to Black people, particularly Black LGBT people. for a lot of people in the HIV movement, the onset of COVID and all the unknowns were very reminiscent of the beginnings of the HIV epidemic. But the one thing that I feel like a lot of people have not really considered is the fact that, you know, conditions for Black gay men have been very bad for a while. And, you know, we don't have to look back 40 years in the HIV epidemic to find parallels with the structural disparities that exist right now, especially when in 2016, they said that the lifetime risk of acquiring HIV for Black gay men is 1 out of 2. That's just something that we kind of like have overlooked. So I think back to Nisi Coates when he says that racism is a visceral experience because it really impacts the condition of my body. So those are some of the things that I've been kind of thinking about, working through and dealing with. And then, you know, as far as some solutions, some very tangible, actionable solutions, for me in my work, I always tell decision makers that it's important to include people living with HIV and impacted community members in all policy, programmatic, and funding decisions. And that's one of the things I've really been championing through this time. Thanks.
Excellent. Thank you for sharing that so much. Aisha, I was going to pull you into this because you've actually done a lot of work in writing in this space around
No,
the
I
civil
have
rights
thoughts
of
on
health.
this.
Yes, please.
No, I have thoughts on this. I mean, I'll start by putting it bluntly, right? We're amongst friends. We are and have been fighting 2 pandemics, and that's the virus and that's racism. And they've been mutually reinforcing each other in incredibly harmful ways. And they've been revealing, I think something that's been really important is not that our systems are broken, but in many ways our systems are doing what they've been designed to do. And that's a really important distinction. And that's why I always emphasize I'm an attorney who uses policy to dismantle systems that were created by policy. And so, you know, I think for me, this work has really deepened my work around the civil rights of health. And Jamila, we've talked a lot about this, but, you know, at its core, the civil rights of health it's a framework that I developed with a law scholar, critical race theorist, Angela Harris from UC Davis. And it's basically a 3-way partnership between civil rights law, public health, and social movements. And we're saying that if these 3 entities are working together, we can get where we need to go. And it's about thinking about health as a matter of justice and civil rights law as a health intervention. And throughout it all, having social movements anchor this work in people's real needs and lived experiences. And you know, to Lauren's point about, right, how this isn't new, it's just showing up in people's consciousness in a new way. You know, civil rights law has been stalled out for a long time. In many ways, public health has been stalled out for a long time, right? We're seeing the racial wealth and health gap, you know, to Devin's point, either not move or even widen. And on the civil rights side, we're seeing that we are stuck in outdated ways of understanding racism, right? We know that racism isn't just some person explicitly telling another person on a one-on-one level that they have a problem with them. It operates implicitly, it operates in systems, it operates through policy. And it's really public health data and ways of showing the ways that racism moves through people and places that can pull civil rights law out of its stuck point. And, you know, we're saying similarly, civil rights law can help move public health along on this journey of anti-racism to really move from theory to action. So that's been a big part of my work, is deepening the civil rights of health and what that means in practice to really ally public health, civil rights, and social movements.
Yes, thank you.
You got me started, Jamila.
I mean, look, get on the pulpit and preach, please. I want to add other voices to this, William or Sarita, especially Sarita, also because you work in the education sector, you're in the third largest school district in the nation. And because, at least in my work, there's sometimes a lot of limited understanding of how connected the education sector, as an example, but along with all the other social determinants, are like education work is also public health work. So share any thoughts that you have in this space as well.
Yeah, sure. I definitely have thoughts, and I kind of lost you there for a second. So I want to like repeat what you just said for.
No, I was just saying because of your work in the education
like
sector.
last 2 seconds, kind of lost you.
Can you hear me now?
Or it could be me.
Yeah, it could be me.
I think it might be my connection.
Okay,
Maybe.
No, feel free. I just wanted you to riff on anything in your work that might connect to equity and how, you know, these movements for social justice are tied into education, which is all tied to public health.
Yeah, can you all hear me now? I think my connection just went bad for a second.
Yeah.
Okay.
Yes.
All right, great. No, yes, definitely have thoughts. So in the one thing that I want to highlight definitely in the school system is definitely going to be how a lot of our kids have been placed in what quote unquote back in the day what they call like special needs classes, of course, or given 504 IEP plans, and IEP stands for individual education plans. And so moving forward, we know based on public health data and just school health data along, and being that there's also a mental health crisis that is tagged on top of on top of COVID-19, and of course on top of racism, that a lot of kids are going to fall right under that again. And so the buzzword, as Lauren said, there's a lot of buzzwords. It's going to be school learning loss. And what does that mean? But there's school learning loss because a lot of our students don't have the resources that they should be already equipped with. And so moving into this, a lot of our students already didn't have the technology that they needed at home in order to, you know, do their homework on a daily basis. And so when everybody, you know, was sent home and we were told that we'd be there for only 2 weeks, there was already learning loss going on prior to that anyway. So there was like a double down effect on that. So a lot of students will be placed in more categories that are actually damaging for them, and there'll be even further more learning loss on top of that. And so that is just another perpetuation of more racist practices that go on in the school system too. So there'll be definitely more Black and brown kids that are going to be kept behind. And then what does that look like? Because they haven't had the resources to help them to succeed or press them forward on as they should have. So that is some of my thoughts of definitely what's going on and how that's inequitable as well.
Thank you so much for sharing that. Absolutely.
So I'll say, you know, what I think one of the biggest things is I don't really think people actually, there's a lot of people out there that really don't actually understand the racism. They don't actually understand racism, and they don't understand the nuances of it, right? Because I've heard many different examples of people say, well, all we need to do is make sure we educate people more. Racism is born of ignorance. It's because people aren't educated. Or I've even heard this too. Well, in about 50, 60 years, so there'll be so many biracial people out there that there won't be any more racism. I'm like, those are some of the dumbest things that I've ever heard in my life. For instance, racism, like Sister Lauren said, racism has not gone away. It's only morphed. It's only changed in the way it presents itself. For instance, people don't understand that, you know, the 3/5 compromise that, before the Civil War, which said the Black bodies could count as 3/5 of a person, so the Southern slave owners could, when it came to politics, could have representation, more representation, you know, in their region. That still exists in the form of the prison industrial complex, right? Those same bodies, 80% of the people in prison for nonviolent drug offenses are Black and brown folks. It doesn't matter the fact that white men around the same age range experiment with drugs and alcohol at a fraction of a percent more than Black people. Still 80% of us in prison for nonviolent drug offenses, right? So even though those people are in prison and they can't vote, they still count towards the population of the area in which those prisons reside, which are usually in rural white areas, essentially turning these prison populations into superdelegates. That is nothing but a morphed version of the Three-Fifths Compromise. We have the 13th Amendment, things like that. People always bring up systematic and institutional racism. You can't be a stupid or ignorant person and design things to work that way 402 years later to still work in your benefit. So there are many brilliant racists out there, right? So this idea that all we need to do is educate people more and racism is going to disappear is absolutely ridiculous. Also, the fact that when we have colorism, it's also a form of like racism. Oh, we're going to have all these, so many people are going to be biracial, that racism is going to disappear. The bar moves, people. The bar moves. Once upon a time, Irish and Italian people weren't considered white either, but they are now. The bar moves. And so first and foremost, before we get anywhere with anything, we really need to make sure people actually understand what racism is and how nuanced it is. And then understand that, racism has been so pervasive in this country that it's inflicted, it permeates everything, that it's inflicted so much trauma upon the Black community that you see disparities in the way COVID is addressed in Black and brown communities. Some of that is because our absolute lack of trust in the healthcare system, because the healthcare system has butchered and brutalized Black and brown folks forever. The study of gynecology was advanced on butchering, Black women, right? People talk about the Tuskegee experiment. That's come about. I've even had to have conversations amongst people in public health here locally when they talk about doing outreach among Black and brown community and getting Black and brown folks to trust getting the vaccine and have to, really educate them and say, you know what, that's going to be a hard task to do. It's not to say that we shouldn't do it. We should do it. But I think your expectations for your success rate are way overblown, because not only did you not do the groundwork in the beginning, right? You can't wait until a pandemic or a national emergency to now push initiatives and try to get people to trust your profession or trust your area expertise. You should have been laying those foundations and doing real equity work and anti-racist work in the community before that. Doing outreach in a community is not 9 to 5 when you have your badge on. Doing real outreach in the community happens all the time. If you don't take your kids to the same playgrounds, if you don't grocery shop in the same grocery stores as these communities that you're supposedly going in to help, two things should happen. That should let you know that you're not doing community engagement. And the second question you should ask yourself is, why don't you feel okay shopping in those same communities or taking your kids to play in those same communities or attend those schools? It lets you know that those two things will let you know that there's an issue, right? And so when we don't lay that groundwork, then we have situations where there's actual hundreds of thousands of dollars and millions of dollars getting put into this outreach work during a worldwide emergency, right? And they're not seeing the numbers that they're getting. They're saying, well, they're not trusting us. They're not coming into doing this. They're not being vaccinated. They don't want to get tested. Well, the study of epigenetics tells us the trauma is passed down at the cellular level. So what that says is, from generation to generation, even though, what might have happened to my great-great-grandfather didn't happen directly to me, that trauma has been passed down at the cellular level, right? So I might not know you, you might not have ever done anything to anybody that looks like me, but I know I don't trust you, right? And because of that, the crazy way in which trauma works is, if I traumatize you enough, eventually I don't have to traumatize you at all, you'll do it to yourself. Trauma becomes culture. There's a lot of things about a lot of our cultures we think is a cultural practice, and it's actually trauma that's never been addressed, and so it's been repeated, right? So not being able to, especially with Black men, a lot of times not going in a Black community, not really getting taken care of, making sure that we look after our health appropriately, right? Even soul food, if you really want to get down to about it, like, we love it, it's a part of our culture, but that ain't healthy, and we know that. We know that at the scientific level, right? We know that it helps create diabetes, high blood pressure, obesity, all those type of things. How did it start out? It didn't start out as supposed to be good food. Those were leftover scraps passed down to our ancestors, and they made it work. And it happened for so long that itself, traumatic experience, became culture. Mm-hmm. That's what we see as culture. And so all that type of stuff perpetuates itself. And until we really break down and really get a nuanced understanding of racism, how racism really affects us, plays a part in the trauma of everybody, and becomes a part of the culture, we'll never really get a good grasp on how to really address it in a systematic or structural way. And we're going to continue to throw away millions of dollars every year in these pseudo fixes of and trainings that we do once a year, like that's supposed to do anything. Behaviors that somebody's been carrying around for 30 some years are not going to be addressed once a year in a 3-hour training. So I think a lot of the disparities and things that we're experiencing right now, we're looking at are a result of just those things that I've explained right there.
Go ahead, Devin. I see you were ready to jump in.
I don't know. I thought I heard you saying something.
No, I just wanted to, I thought that you were about to jump in, so I wanted to make sure you just got in there.
No,
But
I've
no.
commented on this one.
Great. Well, thank you, William. Again, I opened up the pulpit. I'm so glad you got up there and started the revival service. Thank you. So to add, like to build on that, especially when you were talking about when sort of the intergenerational trauma, the fact that systemic racism is both obviously systemic and nuanced and insidious. It to me begs, we are desperate for greater, more visionary public health leadership to see this, to be tracking the ways in which we have tried to address this, the failures, and what more is needed to try to keep working to dismantle a system of power that is really bent on not being dismantled. And all of you are like, we are now having national conversations in this space, having communications with others, talking in the media, writing about this. And I'll start with you on this one, Sarita. Why is leadership at this level important? And what is the value of having platforms and award programs like 40 Under 40 to recognize and elevate work that is actually trying to work at a systemic sort of root causes level to address all of the systemic issues that we are seeing and have seen for decades and centuries? Why is public health needing to be brought to the forefront? And what can programs like 40 Under 40 do to further elevate the work that we've maybe been trying to do for years and years, and just now may have a window of opportunity for it to be elevated further?
Great question. I think it's just important to highlight, the multifaceted voices, of course, that are in public health, and also being able to define what it means to be, to have authentic, true allyship. And so in a lot of the work right now, we see like a lot of allies are, coming up, and allyship has increased, and especially amongst those who a lot of these systems have historically worked for and in favor of. And, we can applaud all of this, but it's very disheartening as a person of color, or for me, I define myself as a Black woman, that people kind of come to you and just like, well, how can I go about being an ally? And don't mind answering those questions, but it's like, are you expecting me to do the work for you? And don't want that to happen. But we also want you to be able to do the work for yourselves and understand what that means to show up and be your authentic self, while we are also trying to be our authentic selves here in this space, and be leaders at the forefront of public health, and defining. And we all know exactly that public health is in everything, from our air quality to sexual health, to nutrition education, to walkability and physical activity. So public health defines everything that we do for our daily lives at a very cellular level. So that is why programs like this are very important. So there's 40 Under 40 programs for finance, business, and everything else that makes, it makes the world go round. It's a lot of dollars in there, but this highlights, like I said, just our public welfare. And that is way more important, because if we don't highlight our public welfare, a lot of us, as we see with COVID-19, you won't be here. So there won't be any other 40 Under 40 programs for business, finance, tech, and all these other things that we place on a pedestal. But there should definitely be other programs to highlight the work that's going on, and that will change those systems as well. So my thoughts.
Thank you. Did anyone have other thoughts?
Yeah, I'll jump in and say, well, first I want to give my kudos to Brian and to the De Beaumont Foundation for even having a vision for this, because there are lots of 40 under 40 lists that exist. And this is the first one to really, truly focus on public health exclusively. So first, kudos to you and thank you for that vision. I think this is just of tremendous importance because of what we're seeing right now. When COVID started, I was viscerally, I would say, very upset by the number of, quite frankly, white men I just saw giving all these press conferences. I know who works in public health departments. I know who the true leaders and thought leaders are in health departments, and they are not all just white men. And so I was very disheartened by that. And so I think that programs like this are essential for lifting up and amplifying the voices of diverse leaders, up and coming leaders, right, in our field, and giving us a platform to be recognized, number one, for our work, and recognized for our thought leadership. The second thing I'll say is that public health is in dire need of a makeover, quite frankly. We need a facelift and a lot of other tucks and some cute clothes and stuff. So we need to put the faces of diverse leaders on Front Street. And that includes many of the people who are here on this panel and even more. We need our creative ideas. We need our connections to community. We need our unapologetic, commitment to anti-racism. We need all of that in public health leadership. The last thing I'll say is I have a lot of friends who are medical doctors, and Brian knows, I go off on tangents and rants with him about this. I go off about this, but we are in a safe space of public health people. And let me just say, I want to see public health leaders talking about public health. Right now, I feel like there are so many MDs, no shade to the MDs. It's all good. You got a doctorate. So do I. But all I'm saying is that I feel like we need more public health leaders giving public health advice and being the voices featured nationally. And medical doctors are trained in something totally different. They're not trained in population health. They are not trained in health equity. They are trained on one-to-one intervention. And until we have more public health leaders as the voice during times of crisis like this, I will not be satisfied. And so I'm grateful for the De Beaumont Foundation, for creating this platform for us.
Yeah, I would say, first and foremost, I agree wholeheartedly with Sarita and Lauren. We don't have enough leaders who are really who care to dare to be different. Nobody has audacity or vision. Everybody sticks to old racist tropes, evidence-based practices and stuff, without even thinking about the fact that these evidence-based practices have racist roots to them too, right? It's all evidence. Most evidence-based practices that a lot of places use are based on it's code word for what are old white men comfortable with? What do old white men think is gonna are gonna work? Dare to be different. Have a vision, move with it, pick different people. You know what I mean? Sometimes you got to be brave enough to say the craziest idea in the room just might work. So why not try it out? I mean, I know that I'm not being super eloquent right now, but whatever. The craziest idea in the room just might work. Why not try it? We've been spending hundreds of millions of dollars the past how many decades trying these, Uber textbook ideas that come from, this guy and that guy, or this doctor and that doctor. And then we have these, we talk about wanting to develop, and we get these new young, bright minds who come into the area, come into the room. They're fired up. They want to try something innovative. They want to try something different. And what do? You stomp the life out of them. They literally stomp the life and creativity out of folks. And I see it in not just public health, but like all walks of life. You stomp the life out of them. And then pretty soon people just want to just come to work for the check. Like, stop doing that. Stop doing that. Like, embrace different ideas. Embrace, ideas coming from different folks. Stop ignoring everybody that doesn't have, like Sister Lauren said, like, doesn't have the doctorate or the PhD or whatnot. You know what I mean? Like, stop sticking to the idea of like, you don't fit the profile. You know what? I don't fit the profile. I get so tired of hearing that, like myself. Like, I'm a doula. Yes, I'm a male. I'm a Black man. I'm a big Black man. And I still help women deliver babies. The only profile that should be necessary for that is, do you want to see babies come into this world happy and healthy and see mothers survive? That should be the only profile for that. My profession shouldn't be seen as women's work. Birth work is family work. And family work is a responsibility of everyone. We always talk about it takes a village to raise a child, but we only equip part of the village to do so. And then we wonder why stuff is jacked up. I, for one, have always said, like, one thing that this country does a great job of doing, and I'm going to bring youth into this, because as adults, we set the example for the youth. But as adults, what we do a great job in this country of still preparing children for the world. We send them out there, mess up, and then we chastise them and treat them like they're stupid. Where did they learn it from? Where are they getting the behaviors from? Where are they learning the lack of creativity from? Where are they learning the lack of innovation and the courage to dare and do different from? They learn it from us. Do something different.
All right, now, thank you very much. I no, really good just transition on that one.
Oh my God.
It's just frustrating. Like,
Absolutely.
I hate sitting, like, going to a meeting and like, we're gonna do a new initiative. But all new initiatives start off with the same 5 first bullet points. And I'm like, why? Why are we doing this?
That initiative is clearly not new. So
Exactly.
that's already a misnomer. But okay, so we have just a few short minutes. I do want to do kind of a lightning round for everyone to give, if you're willing. For those who are undecided or may have reservations, or again, to William's points, there are all of you who are listening, creative, innovative, doing things differently, but you're like, I'm not sure. What is the primary reason that folks should apply for 40 under 40 in public health? And Devin, I'll start with you, and if anyone else has a quick few seconds of advice, please share.
Yeah, so continuing with the way the direction the conversation was going before, so diversity of the healthcare workforce and representation within the healthcare workforce in itself is a public health intervention, and a much needed public health intervention. For all the reasons that have been mentioned thus far, but I think it's important to like acknowledge the importance of having people with a little bit of decision-making authority who are actually representative of the communities that are most impacted by a lot of the healthcare issues that we're so passionate about. So that in itself is reason enough to apply. But on an individual level, I'll say for me, as a person from a marginalized community, it's really easy to not see your work as important, and to doubt your place in certain spaces. I would encourage those who are interested in applying not to buy into that, and to really know your worth, know what it is that you bring to the table, and know the issues that you're working to change. So allow de Beaumont to make the decision as to who qualifies, and don't tell yourself short. I'll just leave with that.
Great, thank you.
Jamila, can I add one thing?
Please.
One of the things we are actually trying to think about is we will do the 40 under 40, but there are a lot more than 40 people who need support and connections. And so I think we're actively trying to think about how we provide a little broader support. And I even think spaces like this are a good example of helping people connect and learning different folks. So even if you apply, we know you, and that's a good first step for everybody. Not every first date ends in marriage, but it might end in a good friendship.
Thanks,
And
Brian.
Jamila, I know you said lightning round, so I'll be quick, but I just want to say to folks, we're so stuck in talking a lot about how the world is, and if you have a vision for how the world should be, to William's point, even if it doesn't seem practical, even if it doesn't seem evidence-based, even if there are naysayers in your places and spaces, apply. Because all of the folks that I shared this virtual stage with, these are folks who see the world how it can and should be. And I think we really need to uplift the vision and the audacity of the folks who are in the vanguard of this field. And I think, to just speak to one of the questions in the comments real quick, it is about moving the field in the direction of liberation, going from health equity to liberation. And I think that's the journey of taking public health out of this sort of patronizing finger wagging that is rooted in racism and moving it to a world where we are expanding the universe of possibilities for folks. We're not narrowing it, we're expanding it. And that's the future of the field, is moving towards collective liberation.
And I would
Thank you
just
so much.
I would just quickly add to that, that when you are a transformative thinker, you also need community. And that is also what's represented here. Like these are my brothers and sisters. We've only met once in person, but they are a part of my network. And I know when I see them in other spaces that it's going to be, what's up, fam? And they are kindred spirits also out here fighting to transform these systems collectively. And I literally hung up on a meeting, like, I have to go, I need to go be with my people. So this is an important network for you to have beyond just professional reasons as well.
Oh, I would agree. I would have to say that, this is, somebody who, knows about, teamwork or being among groups. I'm the son of two military parents. Played sports, high school, college, semi-pro, and this is a bit of a different group or family for me, much more of an important one. Speaking as a Black man, because it was important for me to be in a room of Black and brown men and women. But even some of, like, I'm saying, like, our white brothers and sisters who are part of the cohort, who just be around a bunch of people who have, like, open minds and ready to, like, change the paradigm and change the game. And anybody who knows, when you're doing, like, public health work, or you're doing community work, it's very much like altruistic work, right? It's thankless work, but it gets to be a heavy load to carry at times, because many times you feel like you're doing it by yourself. It gets so much easier when you have 39 other people that you can look at who are pulling just as hard as you are in the exact same direction. It reinvigorates you. And then on top of that, like, I get giddy when I look on LinkedIn or something and I see a project or whatever that one of my brothers and sisters in this group are, like, working on, right? And see the innovation that they're doing. And I learned from them too. There's been times where I've looked online and then gone back to, like, work in a group of, like, yo, I know we've exhausted all avenues. I got this idea from a partner in my cohort. Let's try this. These are also individuals, very bright individuals that, will look out for you. They're a family, like, we network. And what I love about it the most is I'm always looking to pick somebody's brain. I'm always one who's willing to, like, say that I've done my best, but I don't always have all the answers. But guess what? I know another professional, I know another innovative person, I know another expert who is willing to not, think inside the box, not live inside the box and think outside the box, but exist outside that box to begin with, come up with a new great way to do things and help the community. And that is by far the most beneficial part of it. I absolutely love that part of it. That my toolbox grows simply because I'm surrounded by all these great individuals.
And I'll just jump in right quick and agree with everyone else's sentiments as well. Like, this has been a program, I feel like, with intention, and I love the collaborative work that has definitely been going on, and just how we can all show up and be our unapologetic selves in the work. And a lot of our work happens in silos. And this has been a space where we can talk amongst each other and be like, okay, so this is what's happening here in my space. Like, can I get your thoughts about this? And how can I break down the barrier to not continue to work in silos, and also just expand that? And especially for, I will say, for me in school health, it's something totally different. And a lot of people don't think about how effective school health is and how impactful that is. Like, our kids spend a majority of their lives, like, I mean, we all do, at what, at least 18 years or so or more in school. So like, a lot of our first learnings happen there, and our habits and things that we pick up there. So it's just, it definitely been some positive, effective change, and to be able to tap into another network. And, you know, the quote says, your network is your network. So definitely expand on that, and, you know, allow some good things to flourish for yourself. So don't let, you have imposter syndrome, don't let it get to you. Brush that off and keep moving. You are your best. You are your best.
Excellent closing words, Sarita. Thank you so much. On behalf of the Beaumont Foundation, I'd like to thank my lovely, most amazing panel, Devin Hersey, Aisha Pabuku, Dr. Lauren Powell, Sarita Sheely, and William Moore. I also wanted to thank all of you in attendance today for taking the time to be with us today, taking the time to stay with us while we've gone a little over, but we've been just enmeshed in such a wonderful conversation. So thank you all so much to everyone. And so I'll turn it back over to you, Brittany, to provide any closing details, but my heart is full. So thank you all so much. This has been amazing.
Thank you, Jamila. No, I was going to say the same thing. I feel like this conversation was all the coffee I'm going to need for a long time. And I just want to thank you all so much for being your true selves, being your authentic selves, and just challenging everybody to think about the world in a new way and being open to share that with the new world. So just want to thank everybody for being here today. If you have like actually questions about applying for the program, we'll send out you know, the link for today. The email address, if you have questions, is 40under40@beaumont.org. We're happy to answer any questions you might have. But again, this was phenomenal. This is exactly the type of conversations we want to be having with this group, and want to continue as we invite new people into the family. So thank you, everyone, and hope you have a great week.